Rheumatoid arthritis. What is it? And can you do anything about it to alleviate the symptoms? Keep on watching. So rheumatoid arthritis is a long-term condition that causes pain, swelling and stiffness in the joints. It usually affects the hands, feet and wrists, but it can affect other joints as well. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune disease, and this is where the immune system goes a little bit crazy and starts attacking the person's joints. But not only does it attack the joints, it can attack the eyes, the lungs and the heart, leading to an increased risk in heart attacks and heart disease. When I was around 34-35 years old, I was very active. I was competing at quite a high level in martial arts and really enjoyed being physically active and fit. But I started to develop a lot of pains in my shoulders, my wrists, my fingers. They would swell up in my ankles and in my feet. So much so that I had to use a walking stick to walk at some occasions. The doctors did a battery of tests on me and they came back, I was positive for rheumatoid arthritis, which is a little bit unfortunate because most sufferers tend to be women, the majority of, and the minority are men. So I was in the minority. I was prescribed some strong anti-inflammatories, which I had to take daily, plus a drug called methotrexate, which is an immune suppressant. It suppresses your immune system and stops it attacking your joints. But it comes with some quite nasty side effects. Some of them include an upset stomach, diarrhea, migraines, severe headaches, just to name but a few. I had to go to the hospital once a month for blood tests, and this was a test that my immune system wasn't being suppressed too much, and also to test that my liver and kidneys were working fine, because the methotrexate can affect your liver and kidneys. And I thought, I cannot continue down this path, taking these drugs, having to have these blood tests constantly. I need to do something about it. So I did a lot of research into homeopathic remedies and what I can do to ensure that I can manage my illness. So what I'm going to tell you now today is my own experience with rheumatoid arthritis and how I've managed it for the last 20 years. But this is my own experience. I'm not saying this is going to work for everybody, but it worked for me, and I've managed my illness now for 20 years, and I've still been able to exercise and lead a healthy, normal life. So the first thing that I did was keep maintaining exercise. It's basically use it or lose it. So aerobic physical activity and resistance or strength training both can improve the quality of our lives. It can decrease depression and anxiety, and according to a review of research published in May 2016 of the issue of Joint, Bones and Spine, a sedentary lifestyle can harm your health in many ways, from increasing the risk of heart disease to further damaging your joints. A lack of muscle strength can mean a lack of joint protection. So exercise and physical activity also seem to have some anti-inflammatory effects that could have benefits for people with RA. You don't need to run a marathon to reap the benefits of it. You can just use light weights and go for a walk, or just sit on a cycle and pedal, and you can do this for 20-30 minutes a day, maybe 3 or 4 times a week, and it definitely will benefit you. So make sure that you are maintaining exercise. However, if you do get a flare-up, and what a flare-up is for people with RA is that it tends to be a disease of ups and downs. So you can go for a week's, months, and your joints actually feel fine. Then all of a sudden you get a huge flare-up where the joints swell up, become hot, and you almost get flu-like symptoms. So if you are having a flare-up, I would recommend that during that period you back off the exercise just a little bit. Another thing I did was make sure I get enough omega-3. And you can get omega-3 through oily fish, salmon or other cold water fish, but I also supplement daily with a fish oil supplement. If you do get a fish oil supplement, just check out the levels of EPA and DHA. you need to have levels of 500 milligram combined of both of these daily. So just check the ingredients and check the supplement list on the back to make sure that you are getting the right levels. The next one's a no-brainer really. It's just eat healthy. So try and avoid processed and junk foods as much as possible, and if you can, altogether. One trigger for me is sugary foods. If I eat anything sugary, it triggers a flare-up. So what you need to do is to try and avoid processed foods, sugary foods, junk foods, or processed foods, and go for the whole grain varieties. So you don't want to be eating white bread, white pasta, white rice. Try and go for the whole grain ones. Eat plenty of fruits and vegetables. And the next thing I do is take a daily supplement of probiotics. People with RA have been shown to have inflammation of the intestinal tract. This enables certain bacteria to cross the intestinal barrier and trigger an inflammatory response. Probiotics can help stop this from happening. A 2014 study found that people taking a daily probiotic supplement had significantly lower markers of inflammation. So probiotics, combined with healthy eating, can really help reduce inflammation and the occurrence of flare-ups. So to summarise, just make sure that you exercise regularly, you take a probiotic supplement, take an omega-3 supplement, and you eat as healthy as you can. And also, some other things to consider is make sure you get plenty of sleep, at least 7 or 8 hours a night. Try and make sure you drink plenty of water, and try not to get too stressed, as that can also be a trigger. Well, I hope that me sharing my experience with you has helped. I'm not saying it's going to completely cure, but I'm sure that if you follow these guidelines, it will definitely help alleviate some of the symptoms. I've been able to lead a decent life, and I hope you can too. Thanks for watching, and I'll see you soon.